And an official from the health department says that face shields may be removed under certain conditions in outdoor settings to avoid accidents. Let's discuss this further over the phone with infectious diseases expert, Dr. Benjamin Ko. Good evening, Dr. Ben. What is your reaction to this latest development on the much debated issue on face shields?
Good evening, Shao. Well, let me just make a few clarifications, okay? Number one, we know that the virus is not only transmitted by droplets, it is airborne. So let's put two things into perspective. When masks are worn, sometimes we replace it with face shields or a plexiglass barrier. But so the question is, are face shields going to help as well in adding more protection? Kasi kung alam natin na airborne siya, no? That's the first misconception. Na we think that it only spreads through a fast, sudden action. Parang yung pag-ubo o pag-sneeze kasi it will shoot liquid into the air, creating what we call ballistic droplets. But the droplets also are generated from fluid in the respiratory tract through less violent activity katulad ng pagdaldal, no? Pag-breathe natin. And those respiratory droplets from infected people can hang in the air and be inhaled by other people for quite some time. Ito yung tinatawag na mist na hindi nakikita ng mata or what we call airborne solution or aerosol. So yung aerosol contributes to the public misunderstanding ng virus transmission because ang akala ng tao, imagination nila, yung aerosol, yung spray na something that is released in a particular direction. And I think some people also in policymakers think that, you know, ang aerosol transmission is parang spray, isang direction lang. No, that's not the way it works, no? We have to remember that pag sinabi natin ang aerosol, you think of it like spreading like smoke. No? You need to understand how aerosols can get transmitted, and so we understand how the virus becomes easier. Once we compare it, the transmission is easier once we compare aerosols to cigarette smoke instead of a spray. So the air current can force the virus around the corners to reach indirectly, but shouldn't pass through a decent mask. Kaya pinakamaganda pa din po ang mask.
All right, so just to make it clear, of course, the mask is still more effective, but the face shield does add another layer of protection. But Doc Benjamin, the IATF has time and again said that face shields should be worn at all times, indoors, outdoors. Do you think the government should come up with some clearer guidelines? Because, you know, it is not black and white, and therefore it is harder to make people understand when it is appropriate to remove face shields and when it is not appropriate to remove the face shields.
Yeah, so let me make this clear, no? When they create policies, it must be something that is adaptable by all. In short, it should be something that is easy for people to follow. Because when people find it very difficult to follow, the tendency is they will not do it correctly. Masking alone is already not done properly, while 100% probably will wear a mask. Some of them have it under their chin, some have it their nose sticking out, and so on and so forth. In the same way as face shields, that you see the majority of people wearing it on top of their head. But let me just well, since I'm already on the interview, say it with a personal conviction that a personal protective equipment, which is what a face shield is, no? It's a form of personal protective equipment. It should be appropriate for the situation where it is being used. Example, you do not wear a hard hat to a construction site because you want to protect yourself from noise. Nor would you use a pair of ear defenders to prevent objects from hitting your head. So the face shield will not create an effective barrier against a virus that is carried in an aerosol transmission.
All right. Thank you for making that very, very clear. And I like that analogy about smoke. That's actually the clearest I can imagine, Doc. But do you think in the near future, or maybe in the not so near future, do you think we can ditch face shields altogether? Of course, we're hearing news from the United States where they've ditched face masks altogether in some states.
Well, hopefully we do. And the reason why I think that we should eventually is because of the news that the Philippines is one of the biggest contributors to plastics that are found in the environment. And it will take 100 years to dissolve all of these plastics. And because of that, we're using an equipment that's not going to be helpful also to the environment. A. Letter B. If you look at the utilization of face shields, you must find one whether you must ask if the person that is using it is using one that is reusable or one that is disposable. There's a difference between a reusable plastic shield and a disposable one. Because like everything else, when it is disposable, it must be thrown away after every use. And therefore, it becomes more expensive.
All right. Doc, yes. Let me just change the conversation a little bit. I want to ask you about variants. Of course, in recent days, we've heard some things about this Delta variant and the threat that it poses. What do we know so far about this variant, and is it actually present here in the Philippines?
Well, we've identified already in some patients the Delta variant. However, that it's not the predominant variant of concern that is circulating in the country. So that is the good news. Number one. Number two, if you look at the Delta variant, it is supposedly more transmissible, and it has symptoms that are actually one that cause more morbidity and more mortality. So in short, parang mas deadlier siya. Mm-hmm. So yun ang alam natin. And, some of the vaccines may not work against the Delta variant. So that's another thing that we'd like to look at.
All right. Thank you so much, Dr. Benjamin. I guess we really have to uphold these safety protocols and follow them on our own, without having to be reminded. Thank you so much for your time, infectious diseases expert.
Can I just say something as well?
Sure, of course.
Since we're already there. I was just going to say that one of the reasons why the Delta variant may be a big concern as well in the country, the fact that we do not have one single vaccine that we are using. It's not like the US or the UK or other countries wherein there is only a set of vaccines that are being used. Like in the US, for example, they're only using mRNA. And the only one that they've rolled out that is a subunit vaccine is the J&J. So yun lang. Pero dito, ang dami natin varieties. May activated tayo, meron tayong adenovirus, meron tayong mRNA. So lahat sila, iba-iba yung kanilang efficacy sa clinical trial. And because iba-iba ang kanilang efficacy at iba-iba din ang kanilang the way they will protect against the variant, makes it more difficult for us to be able to monitor whether these variants of concern will be a concern later on.
All right. Thank you so much for adding that little bit. That was a very, very informative. Again, on the phone, that was infectious diseases expert, Dr. Benjamin Ko. Dr. Ko, thank you for your time, as usual.